Once again, good morning and good afternoon, everyone. Thank you for joining us for the Client Satisfaction Project WebEx. We would like to go ahead and get started. And with that, we'll go to the next slide, which is on a bit of housekeeping for our time together. So the webinar is scheduled for about an hour, and we expect this will include ample time for questions. We have tried to mute all of your lines. However, sometimes the technology is such that we still have some background noise. So just check if you can to mute your phone or mute your computer and make sure your video is off. That would help to ensure that we have a smooth presentation. We also ask that you don't put your call on hold if you are on your phone. Sometimes that will also interfere with the presentation. So as I said, we expect to have plenty of time for questions, and we will at that time ask you to type those in the chat box. However, if you have questions as we're going through the slides, feel free to go ahead and start putting those into the chat box, and then we'll move to those at that time. And then finally, we will be recording the webinar and plan to post the recording as well as this PowerPoint that we'll be sharing today on the DAT Toolkit soon after the completion of today's webinar. As for our agenda, we're going to start in just a minute with introducing who we are, so you know who is presenting today. We'll do a quick overview of the project, a bit about the approach that was used, focus on the key findings of the research, provide just a handful of examples that we gleaned from the research, as well as some recommendations, resources, and again, finally, just making sure that you know where to find everything after today's webinar.
Hi, everyone. So my name is Austin Francini, and I am part of the performance assessment team, which is part of continuous improvement at national headquarters. My job is to do the DCS regional goals, tracking the analytics, tracking the metrics that are associated with the RDO goals that regions are held to. As part of this project, the overlap is with client satisfaction. So any questions that you have about client satisfaction on the day-to-day tracking, that would be my area of expertise.
And hello, everyone. My name is Alicia Guajardo, and I am the Senior Associate for Regional Response, and I manage and oversee the Disaster Action Team program at National Headquarters. And as Austin stated, we work very closely together. This is one example of that with regard to the Client Satisfaction Survey. We also have a third presenter who has been delayed in joining us. Hopefully he will be able to. You'll see his name on the screen, Leonard Levy, who is part of recovery services. And so again, we hope that will be able to join us later. So a short overview of this project. As you know, client satisfaction, as measured through the Client Satisfaction Survey, has been included in the regional goals since fiscal year 17 through to the current fiscal year. And the scores that are given to the regions have been based on ratings from clients who receive and complete the survey via text message after the Red Cross has provided services. And that includes both the services of our disaster action teams as well as our recovery caseworkers. Some regions have faced challenges in improving those overall scores. So it was decided that this fiscal year we would take a closer look at what the regions are doing or perhaps not doing, and also conduct a qualitative analysis of the client comments that come as part of those text messages in that survey. So again, our research that we'll be speaking to includes some key findings, as well as recommendations and just a sampling of best practices.
So, everyone, this is Austin again. The approach that we took with this project actually includes two aspects. One, response and recovery. Alicia's team and Leonard's team conducted interviews with 21 regions between May and September last year, and then met with them to discuss what they were doing. They were broken up into two groups, higher performing regions and the lower performing regions. Wanted to get some best practices and find out how people were showing that progress in order to share that. The performance assessment team, myself, as I was involved with the client satisfaction collection, I analyzed the comments that we received in FY19 and were able to categorize them into themes. The end result was trying to identify some actionable feedback based on what was said by clients in their comment in their client satisfaction comments. The regions interviewed through the response and recovery portion of the project are listed here. Alicia, correct me if I'm wrong, this is both the high performing regions and low performing regions, and not in any particular order.
Correct. I think we tried to do it in alphabetical order.
Yeah.
Yeah.
The questions that were asked of the regions were both in what they were doing within their programs, how their organizational structures were laid out, both with that and with the recovery teams, and then also checking if there was a correlation between service delivery and satisfaction scores, the best practices that were in use. And then any suggested process changes that were mentioned by the regions. There was feedback across the board, and so those were collected and brought into a key findings document. So, and as mentioned, the key findings are both setting expectations and customer service. And so these findings were found both in the responsive recovery portion, as well as the comments analysis portion done by performance assessment. The setting expectations is both of these are pretty self-explanatory, but just want to make sure importance of setting clear expectations on what Red Cross services are, and both as often as possible from the beginning, but also throughout the process. As of course, as most of you know, that even though our services are standard, because of a client situation, that may make them more eligible for services or less eligible services. So making sure that's clear. In customer service, looking at what is both what is behind both great and poor customer service that may result in higher or lower ratings. Within the client analysis process, we looked at 12,731 comments, and this was all the comments received in FY19 through the client satisfaction survey. Comments were sorted into 10 categories. Another word for categories is themes. So we identified 10 themes that comments were speaking to or about. Some comments were falling into multiple categories. Great customer service was only mentioned for ratings below average and above. And so if you recall, the ratings that were available on client satisfaction is excellent, above average, excellent, very good, above average, below average, poor, and very poor. And so again, great customer service was only mentioned for below average and above. Need more help had the highest frequency of ratings um, for below average and worse ratings. And then within that, housing was the largest additional need identified. So when a comment indicated that they need more help, if we were able to identify in their comments what exactly that request was for, then those were subcategorized. Um, the categories of comments included appreciative, great customer service, follow-up requested, poor customer service, interested in volunteering, and then need more help, which had subcategories of housing, financial, or physical. And then miscellaneous is a kind of bucket that collects comments that were um, sometimes unintelligible, sometimes inactionable, um, and the sort. I do see, Alicia, I do see a question came in, and it is related to what I'm talking about. Do you want to save the question or address it now?
You can go ahead and address it.
So the question that came in is, can you please explain great customer service piece more? So as we got comments that talked about, for instance, quite a few mentioned specific volunteers that did an excellent job, or a lot of comments about Red Cross volunteers being angels. Uh, Things along those lines that indicated that they were they'd probably give us a 5-star on Yelp. But that was kind of what I was leaning towards putting in the great customer service category. Um, uh, Whenever it was mentioned, um, uh, so as volunteers and as staff of the Red Cross, we know that arriving on scene within 2 hours is the expectation of our program. Um, but some volunteers were specifically calling out that they were just extremely appreciative of the prompt response, and so that was included in the great customer service as well. Um, I hope that answers the question. Feel free to ask another if you need more clarification. Yep. Um, and so as I mentioned, we did review 12,000 comments that fell into FY19. Um, But I live in Arizona myself, and so I actually got the help of um, the volunteer coordinator here in Phoenix, Daniel Rudolph. She helped connect me to a Red Cross club at the Arizona State, and so they actually helped us categorize FY17 and FY18 comments as well. So we have 3 years worth of comments that have been made available, and they have been categorized by theme. And so when we share this PowerPoint and as a PDF, you'll be able to click the link there and see there are division specific files that have comments from FY17, FY18, and FY19 available for you to filter, um, create pivot tables on, etc. There's some analysis that there's some additional analysis that could be done. We wanted to keep the scope of our project pretty focused um, on pulling out those key findings and identify those themes. But you can certainly combine the data with CAS data, as the CAS ID field is something that's included, and so you can look at those additional layers.
Okay, so I'm going to now cover some of the things that we heard as we were talking to the 21 regions that we had interviews with. So as you heard, one of the key findings was around setting expectations. And so one of the important things that we heard is that it's important to set expectations early on, not only through our DAT folks, but as well as as part of that, that process of the casework, recovery casework. And, to remind the client, for example, that they will receive a survey, prior to the case closure. Another thing is we learned that there are regions that have developed materials to help explain what Red Cross services are, and that information, those materials are provided to the client. So there's a couple kind of examples of that. If you can see it on the slide around, again, just kind of what the Red Cross services are and what to expect, and that make a difference in providing that information and having that conversation with the client. For our workforce, some regions have also created a number of wonderful things, such as a video focusing on a good hello and a good goodbye. Also creating talking points for their volunteers that focus on that message as well. So again, we'll later in the presentation, we'll talk about where and show you where you can find those examples. But just to leave you with maybe another couple of examples around setting expectations. We heard from a couple of regions who have gone to the trouble of surveying the entire workforce to find out what they are doing, as well as what they need, like what support they need, what other types of things they might need to do the best job that they can in assisting the client. And finally, incorporating expectation setting into all formal as well as informal training and communications with the workforce is really important, and not as just a one-off, but to have it as part of a regular conversation. Now, with respect for training, there are a lot of opportunities in this regard, but some of the things that we heard from the regions that we spoke to include the following. Discussing it regularly at meetings, whether they be DAT meetings, recovery meetings, joint meetings, any kind of meeting where you have the workforce together, and not only talking about it, but really having time and taking time to include the why of why this is important that we focus on this, and that it really is focused on providing the best care and compassionate care and services to our clients every single time. So with that, we also heard that, emphasizing to our workforce that this is a caring and compassionate interaction, and it should not be handled like a transaction. So again, we'll talk a little bit more about that, but really, again, focusing on that caring and compassionate and comfort part of the work that we do. Strong follow-up casework is also a really important and vital part of the client's experience overall, and we heard that over and over again. Another thing was the importance of engaging and coordinating with and between all of the different programs and services. So it's not just DAT and it's not just recovery, but we're working together and collaborating closely with our workforce engagement teams, our health services, our mental health services, our public affairs, our volunteer services. So again, it really, although I think we all know this and understand this, that this was really, really pointed to having and ensuring that we are doing the best that we can around customer service. Another thing that a lot of regions are doing is to utilize the Client Satisfaction Survey client feedback to spotlight outstanding work of teams and individuals, and also to use that feedback to identify and focus on problem areas that may need attention. Some regions have developed some type of mentoring program, such as a buddy system for trainees with more experienced DAT members. And another thing is really to know that these types of activities can help with regular engagement and support for our volunteers. Still others, regions talked about boot camps to help bridge the data and recovery work so that certainly to the client that it is seamless, that this is all, Red Cross providing services. And we heard that this collaboration and full understanding isn't always there. So it is an area, an opportunity for us to improve. Making sure, again, that those expectations are not only set for the client, but that they're also important that we are clear on the expectations for our workforce, that we're clear, and that every single volunteer and employee understand the procedures and the requirements of the job and the position that they hold. And then finally, one other example is some regions have a formal on-call schedule, which helps them in engaging and activating their support services, such as disaster health services or mental health and public affairs. So regions also spoke to us about sort of the external audiences, and we referring to this as marketing and promoting, basically what we do as Red Cross. So the development of materials that can help educate and provide information to our partners. So this could be done in the form of a flyer, for example. There's a little screenshot on the slide with info of when and where to contact the Red Cross. We've heard of other regions who have created other types of like business card things with the essential information, others that have done presentations, on a regular basis with their fire departments and others. Another thing we heard was that strong and robust community partnerships help us to provide the best referrals and so that it really is important to ensure that the partners understand our services and how they can assist beyond what the Red Cross may be able to offer. And then one other point that we wanted to highlight around this idea of kind of connecting with our external partners is increasing public awareness of our daily mission. That so many of our volunteers, every single day, as we know, day and night, are out there providing really wonderful, caring, compassionate services. They are our unsung heroes. And so, we're working now with communications to help get that story out. And you'll hear more in the near future about that. The one other thing is around, again, the strong follow-up and referral resources. So providing accurate and regularly updated referral list really helps to improve that experience for the client. Recovery and information packets are something that a lot of regions have as something to provide to the client. Also, the timeliness and the quality of our follow-up by our caseworkers, that we're ensuring that they take the time that's needed, that one region shared with us that they actually assign one caseworker who follows the client and or family, if you will, throughout the sort of the life of the case. And still another region shared that it's really helped them a lot to encourage folks to come into the office. So if that's feasible, it really helps to build that fellowship and really just that we're all in this together. One last point regarding the interviews that we conducted. We also wanted to hear about, what regions are doing that's more related to the process of that they take around this. And so we heard that, and regions really agreed that having consistency across the entire region, as well as adherence to standards and procedures, both for our DAT and our recovery, phases, is so important. That again, on-call scheduling, which includes those support roles, really helps to ensure again that everything that we're doing to support and assist the client is seamless. Communication and training on that interdependence of programs. Again, I spoke to that earlier around working together and across programs and activities. Following up with later with clients as well to connect them with other services. One example that was provided by a region was that they will do this in connection with their home fire campaign and installation of smoke alarms. And finally, again, this idea of ensuring a seamless process and a transition from that immediate assistance that's provided by our disaster action teams and over to our recovery caseworkers that follow on with the client for days and weeks.
So continuing on with the recommendations, as a result of the key findings, with setting expectations and looking at the client satisfaction analysis, many of the negative comments or the comments associated with the lower ratings alluded to clients having beliefs about what the Red Cross would provide and those expectations not being met. So an example of this is I feel that the Red Cross was only there for immediate assistance and that was it. I needed long-term help and all I got was $125. So as Red Cross members and volunteers and staff, we know that Red Cross is an immediate needs organization. We provide that immediate help and don't provide long-term support as far as months and months of rent or anything like that. So by some folks don't have that expectation. They have a wider expectation of what we would provide, and when that's not met, they're disappointed, understandably. But so setting expectations about that from the beginning will allow us to resolve some of those lower ratings. Regions interviewed shared this as a focus of their efforts to improve their customer service and overall client satisfaction as well. So this was a finding in both the comment analysis and also the region interviews. Set expectations early by providing more information up front during the initial interview and during the first follow-up. So we did receive a comment in the chat box that also mentioned something along these lines of DAT workers, for instance, making it clear that the direct client assistance is for room and board, and to not necessarily spend all the money on food and clothing when housing is needed, to make sure they understand what those dollars are going for. That's an example of setting expectations that would help. And a comment that was frequently, or that I also saw several times, was that sometimes clients are told on the scene by DAT workers that additional assistance is available, but sometimes when it was a negative comment, and that occurred, it was because caseworkers at a later time determined that supplemental assistance wasn't available based on the situation. So so making sure that's understood by the client, or perhaps isn't mentioned by the DAT worker, is another way that we can make sure not to set the expectation too high when it's not guaranteed that supplemental assistance will be available. And I just want to make sure it captured. Yep. So moving on to customer service, we want to make sure we provide training opportunities for DAT responders and recovery caseworkers to focus on the topic of customer service. We did receive specific examples, but overall the skills that were mentioned were the soft skills listed. That's professionalism, empathy, compassion, caring, active listening, and trauma-focused assistance. Certainly that's not indicating, by no means does that indicate that all our caseworkers or even a majority of our caseworkers are lacking in these, but the comments do indicate that there are clients that feel that these soft skills aren't present when they're working with either caseworkers or DAT members in the organization. And so we want to potentially offer these training opportunities to DAT responders and recovery caseworkers to be able to increase those skills. There's also an opportunity that has been available, and want to make sure that it's known to all regions and divisions that comments that we receive through client satisfaction are posted on a SharePoint, and so they are able to be reviewed by regions. And so if there are through reviewing those comments, if there are specific volunteers or specific cases that mentioned lower ratings or mention issues, then those comments are associated with CAS IDs, and so we are able, as a region, you are able to look at that case and see and kind of do an audit of why maybe there was a low rating. So that is an opportunity that does exist currently and will continue to. And lastly, ensuring regional staff and volunteers utilize already existing resources available to guide conversations with volunteers who are mentioned. So again, I want to emphasize that we have a vast majority of comments are extremely positive. We receive excellent ratings from a vast majority of clients, but there are comments that do mention volunteers and managers and staff by name as far as not having a positive interaction. And so there are some resources that will be specifically mentioned later as in a resources tab on how to have those conversations with correcting behavior with individuals who are mentioned in those comments. And again, there are a significant number of positive comments. So we don't want to necessarily focus on the negative comments and correcting behavior. We also want to make sure that the comments that are positive, that mentioned how thankful people are, and especially those that call out volunteers by name, are provided back to that volunteer so they know their efforts are appreciated. And Alicia mentioned this as well, providing concrete referrals. Sometimes when uh, clients receive referrals, sometimes those referral lists are outdated, or one comment I remember in particular was that the agency that provided that was mentioned as a referral was able to help, but the person who answered the phone had no idea anything about the Red Cross or the relationship between the organizations. So perhaps there's more work to be done with ensuring partners understand what Red Cross does and how we do that handoff to other agencies to help with various aspects of recovery. Making sure there's a strong volunteer-led program that mirrors the makeup of the community. This has been a focus for a long time for the organization, and so there's been some positivity associated with having that kind of program in the field, and of course making sure that the program implementation across the region is consistent. There was a lot of effort in the last few years to make sure nationally we were implementing a standardized program, and so making sure that the regions it's the same across the region as well. And Lisha, I'll hand it off to you.
Thanks, Austin. Right, so I know there have been a couple of questions in the chat around the materials and where you can find them. So we're going to touch on that next. So you'll see here on the slide, we've listed a whole slew of resources. This particular table you will find in the Client Satisfaction Survey Findings and Best Practices Report, which is posted on the DAT Toolkit. And so we won't go through every single one of these, but just to highlight a few of them. Again, for those of you that have an interest in seeing how a lot of this information is consolidated into a dashboard around the regional goals, which of course the client satisfaction is one of those, is available to you to look at. There is a regional data and reporting SharePoint, and again, that site includes a lot of different information. Austin mentioned some of that. Most importantly for this topic, the client satisfaction analysis data, those division-specific files are posted here in that SharePoint. The regional reporting portal is on the Exchange. Again, that's tied to our current fiscal year goals. And there are some related documents, such as the Doctrine Bulletin that talks about the process and the survey and the kind of the who, what, where, why we have it. The client satisfaction SharePoint is something that is new and will continue to evolve. And this is where some of these samples and templates that we've received so far from regions are posted. We've also posted a number of links to other resources on this SharePoint, and I'll talk more about that in a second. There are some of trainings that speak to the client satisfaction survey, a number of toolkits on the Exchange that I think probably all or most of you are quite familiar with, around the casework and recovery planning, the engaging volunteers and employees toolkit. There are also a number of toolkits that Volunteer Services has posted, which focus on things like engagement of volunteers, retention, evaluation, and so forth. A couple of other final things I wanted to point out here is that there is a dashboard that is focused on home fire responses, and is quite an interesting one to look at if you have an interest in really zooming into kind of your region or your chapter and kind of the work that you're doing. And then finally, around leadership opportunities, such as the mentoring and buddy system that we spoke to, there is an entire toolkit that's focused on chapter program leadership. So again, all of this table you will find in that report that is on the DAT Toolkit. So here is just a snapshot of where you actually will find this. So this is on the main page of the DAT Toolkit, and there is a section, if you kind of scroll through the page, that has a heading of client satisfaction. So again, you'll find links there to the client satisfaction SharePoint, to two different reports. One is sort of a summary of both the interview findings as well and best practice, as well as the qualitative analysis that Austin has been sharing with us. Separate from that, there's also a more detailed qualitative analysis report that is available to you via this section. And then, as I've already mentioned, we have the SharePoint and some other things there. So again, this is all on the DAT Toolkit under client satisfaction to get you to all of these different resources. So the client satisfaction SharePoint, again, this is just a little kind of section of it. We do have a place for documents. So if you can see, I know it's quite small on this slide, but we do have some folders set up where there are project files and reports. We also have probably where what you're most interested in are regional examples. And this is a place that, again, this is evolving, this is dynamic. We really see this as a collaborative space where you can not only go to find examples that have already been shared with us, but to also share your own region's work. Just to remind you that during those interviews, we only spoke to just over 20 regions. So there's a lot more of you out there that I think have likely done and created some really useful materials. And we'd really like to have you share those and you're able to upload those to this site. Ultimately, what we will do kind of down the road is probably look at streamlining some of those, creating some templates to make it as easy as possible so that you're not having to create anything from scratch, but maybe just plug in your own specific regional or chapter of territory information. And then maybe the last thing I want to mention here that you can find on the SharePoint is that we do have some various links. You'll just see a couple there on the bottom left. But this, you'll find like that video that was mentioned around that good hello, good goodbye, as well as a discussion and sharing section on the SharePoint.
So to round out the presentation, just wanted to give an opportunity for people to ask questions. We have some questions in the Q&A box, and so I'll answer those. But I also wanted to mention that feel free to enter any more into the Q&A or the chat box, and we'll get those addressed for you here before we end the call. So first question we have was from earlier in the presentation. Have you found any correlation in ratings between activating CACs in front of the client versus off-site? As we did not do that. I did not do that analysis between as far as looking at ratings as it compares to when CACs were activated. I didn't look at any RC view, or I'm sorry, RC dispatch information, but that is certainly something that regions are able to do. I stuck with identifying the themes of the comments themselves and how the themes related to the ratings that were received. So I would encourage you to look at that. That might provide some interesting insight. We also received a question, did you find that partner agencies are getting included in the ARC ratings? So as I mentioned, I do the monthly client satisfaction survey. I also do the cleaning of the data that comes in. And so what I do is I try to identify whenever the comments are related to other agencies. So sometimes we will receive ratings that indicate that they are speaking about services received from another organization. And in that case, I do actually remove that rating and that in the comment from our system. So those ratings are then not applied to our regions or our organization. Certainly, I can't catch all of these, but I do my best to try to catch them when I can. Is there a specific date when the analysis reports are completed each month? So I just wanted to confirm the language used here that we do a client satisfaction survey on the 5th and the 20th of each month. And then on the 27th or roughly around that time, I do an export of that information and then do a report of that data, a division specific report, and post that. That information is also then used in the regional goal dashboard that's used to present the FY20 goals that regions are held to. The analysis reports won't be additional analysis to this level won't necessarily be done for the FY20 comments. We won't do theming. There is no intention at this point to do themes for the FY20 comments as of yet. So as far as the analysis of the comments themselves, that will be that will stick with the FY17, FY18, and FY19, and those are complete, and so those are made available. Um, I can't speak at this point if we will ever do that we won't ever do the theming analysis of FY20, but it's just not in the works right at this moment. Um, and we did get a comment about an approach used that we'll include in the that perhaps is something if it's part of if you have suggestions about what your region does, Alicia, what's the best way to submit additional ideas um, for client satisfaction, regional best practices, regional examples, etc.
Yeah, thank you. Those can be sent to me directly, or probably easier because my name has a lot of vowels in it, is just to the DAT@redcross.org email. If it merits a conversation, please feel free to give me a call. My information is in the address book. Would love to talk to any of you about this. You can also upload your examples directly to that SharePoint site, the client satisfaction SharePoint that is. But I would like to know, we're monitoring that, but we want to make sure we don't miss anything. So again, feel free to send or reach out to me directly.
So that does cover all the questions we have in our Q&A as well as our chat.
Austin?
Oh, yes.
Austin, I'm sorry. Yeah, I noticed that there were a few that were sent directly to the host. So I think maybe you can see those. So let me just go over those with, since we still have a few minutes.
Sounds good.
So there's a question of if there are any scripts of what to say to clients, or maybe specific terms to use with clients. So the short answer is, well, yes and no. So we did have, we did hear from regions that they're working on something like that. We mentioned and this is something that's already posted on the SharePoint, that of talking points, which will help guide the Red Cross worker on kind of what to say and how to have that conversation, and have a good conversation with the client. We're still looking at whether kind of in terms of like specific scripts that might be suggested. So we'll kind of make a note that there is interest beyond kind of maybe one region that we heard from that's working on that. Another question is, do regions that have high client satisfaction scores give clients a phone number to call if they have a question? And if so, what number? Because many of our volunteers do not want to give out their personal phone number. Austin, I mean, I think we can both maybe speak to that, but I don't know if there was anything specific to your analysis that addresses part of this question.
So facetiously, if we don't have an accurate phone number in the system for the client, then they won't receive a client satisfaction survey, in which case they won't rate us poorly. No, I'm just kidding. But if they don't have a number.
So Austin, let me just clarify to make sure. And so they're asking about a Red Cross number. Like, what is the number that the Red Cross worker is giving to the client? Is there a standard like 800 number, for example? Because again, volunteers don't want to give out their own phone number.
So it's I would say that's a very region specific and possibly even chapter specific question. I would my old region, Arizona, we had a phone number for our region dispatch, and we weren't on the national dispatch system yet as at the point I was there. So there was a region number that they could call, and most of the time that went to a central office during the day, and our caseworkers were there, and that's where our DPMs and DPSs were. So they could ask questions there, and we had little business cards that we just included with the DAT folders. But again, that's not to say that is the process for any other region besides Arizona, but that's an example of it.
Yeah, and I think just to add to that, so and just to concur with Austin, that it does vary because some of it depends on your local dispatch process. Are you on RC View DAT dispatch? Are you on DCS Ops? Are you on some other kind of answering service or something like that? But I think kind of what I'm taking away from this is there are ways to make sure that our volunteers are not having to give out their personal phone number. I think in the Yammer groups, if you follow those, I remember seeing some great suggestions around using Google Voice. You can also do other types of things. So we'll kind of take this as something that we can continue to kind of make sure we provide some guidance and suggestions on that particular point. Another question is, let me see, I have the SharePoint open, but can only see the reports for the monthly results. Can you direct me to where the resources are? So I think this might be maybe referring to the DCS reporting SharePoint. I don't know if you can provide any guidance.
Can you repeat the question?
Yep. So it says, I have the SharePoint open, but can only see the reports for the monthly results. Can you direct me to where the resources are?
SharePoint, I only see the monthly results. If I follow, so then if you're in the, I don't know if you're referring to the regional data and reporting SharePoint, which is where most of the stuff that covers the comment analysis sits. But from the home, from the initial page, you would just go to regional goal folders, and then there's a client satisfaction analysis that includes the division specific files. The comment analysis document that that Alicia mentioned. I think perhaps when you say monthly files, you might be in the FY20 client satisfaction document, in which case this is the monthly updated files for FY20. So this is the stuff I was talking about is that regions can review each month to see comments and provide corrective action and stay on top of that sort of thing throughout the year. But for the comment analysis, that is going to be in this client satisfaction analysis folder. I hope that addresses the question.
Yeah, it looks like that did. So thank you for that. Yes. Let me just look and see if there's anything else here. Okay, I don't think I see anything else. And I know we've just got a few minutes till the top of the hour. So we want to just remind you again that if you have questions or comments, any type of feedback, anything you'd like to share, feel free to reach out to the DAT@redcross.org mailbox or reach out to me, Alicia Guajardo, directly. If it's something that is more appropriate for Austin to answer, of course, I'll make sure that he gets that as well, or even Leonard, who was unable to be with us today. As we mentioned at the beginning, we want to say thank you again for joining us today. We have been recording this, and as soon as we get the recording downloaded and cleaned up, we'll make sure to get that posted and communicated out through various channels, the cross connection, the Yammer groups, and so forth, so that you know that it's available. But in the meantime, you can go ahead and just keep checking the toolkit. You know, once you've reviewed the resources, again, if you've got any questions, just let us know. And as always, thank you so much for all that you do in whatever roles that that you play. And we hope you have a good rest of the day and the week. Thank you.
Thank you all.